This exercise is called an up-down. We think here at Evolve that it's better in most cases than a burpee for most people because the technique is a little bit easier. We can still get the heart rate up. We can still work some full body coordination and power. There's a little less injury risk on the wrists, shoulders, and knees. And so people tend to be a little more efficient and a little more effective than our traditional burpee. If you're doing burpees, we got a whole video breaking down burpee technique. We're gonna go over a couple of those pointers here. We call this the up down. So I'm gonna start standing and then I'm gonna place my hands and I'm gonna jump back, jump forward, stand, squeeze my glutes to stand all the way up. That's one rep. So just show again. I'm gonna place my hands, jump back, jump up, stand, squeeze my glutes. That's one rep. Okay, breaking a couple things down. So we want to land in a good foot and ankle and knee position when we jump up. So I'm getting my hands down into a push-up position, and then when I jump up, I want to be in a good squat position here. So I want to have my knees stabilizing. I'm pulling them out with my hip muscles, my weight's on my midfoot and my heel, and I'm not real narrow and on my toes. Sometimes, particularly as people fatigue, we see this more with the burpee, but people will jump back and then they'll jump up and boom, slam on their toes and their knees. They could hurt their big toe, hurt their knee, compress in here at the hip. And so I've seen some injury issues in burpees or some discomfort from that. So in the up down, we want to place the hands and jump flat. If you're fatiguing or if your mobility does not allow that, we got some options. So we can come back, we can jump back, and then we can step up. Squeeze the glutes, stand tall. Show that again. Jump back, step, step up. Through a set of 10 or 20, I'll try and alternate which step or which foot I step forward first with. So I'm going to come back, left foot, right foot, up, back down, right foot, left foot, up. So I got a nice, good foot placement there. Okay, if we have wrist or shoulder issues in the burpee, that's why we advocate placing the hands before I jump back. Because sometimes you'll see people starting from the top and they'll just jump for the ground. And it's kind of like, oh, where am I going to land? And so it's a little easier on the wrists and the shoulders if we place the hands and then jump back and jump or step up. If that jump back is troublesome for you, then we can place the hands and just step back and step up. So we'll step in both ways. Some people who have a history of low back pain, just coming up and down like this can be a little sensitive. So if that's you, we still got a couple options. One, we can go a wide stance, focus on sending the hips back, and now I have a lot less flexion in my back. So I'm going to stay real wide throughout my up down. And that's often a little easier on the low back. Okay? Last option, if these are still not feeling great for you on the low back, on the knees, hips, whatever it might be, we can elevate it. So I got a bench here, so I'm gonna do the same thing on an elevated surface. So I'm gonna stand maybe 2 feet away, hands down, jump back, jump up, and boom. Jump back, jump up, good, squeeze the glutes. Now if I cycle these pretty quick, I'm gonna start getting out of breath, which is often the stimulus we want from something like the up down. The same modifications still apply on the elevated surface. We can jump back, step up. Okay. We can come down, step back, step up, like that. And we can go with our wide stance. With a step or a jump on that wide stance. Finally, some people have a little trouble with their wrists. So they don't like coming in to that wrist extension. So what we're going to do, I'm going to grab a quick set of dumbbells. So I got a set of dumbbells. Because we're not jumping onto the ground, I can now use these dumbbells to keep my wrist in neutral. So I can be here, because I'm placing my hands, I can be really precise. And so I can get here, place my hands, grip those dumbbells real tight, jump back, jump forward and up. Jump back, jump forward and up. Or I can do my step back, step up, stand. Elevated surface as well. I can take these guys, put them here. Of course, I want to be sure that I'm not pushing the dumbbells off, but I'm going to be here, and I'm going to jump back and jump forward and stand. But if that helps with people with that wrist extension pain, that's something that we can typically figure out in physical therapy, but to get through your workout today, that's a nice, easy modification that can alleviate some of that wrist pain. But we just don't want to jump into those dumbbells, be really precise, grip those things in a nice, sturdy way. So that's the up, down, and a couple modifications. We like to throw this into some of our conditioning workouts. We also like to program it for adult athletes who might have fear or difficulty getting up and down from the floor. So once we're comfortable with that, then we can work it in a workout fashion, elevate the heart rate, and get a lot of other health benefits from it. So give that a shot, especially if you've been having problems with the burpee. Try the up, down, and some of those modifications.